This is part 2 of our discussion on foster care, kind of learning the system. And last time, we had Tanya give us a description of how it kind of works from the Topeka level. And now we're going to have the opportunity to visit with our 6 regional directors out there as well via WebEx. I hope we've got everyone on. And I'm going to welcome Tanya to committee and let her lead us off and kind of give us an overview of how it flows on that level. So,
thank you. Good afternoon, Madam Chair and committee. Thanks so much for inviting us back so we can give you a little bit more information. I'm Tanya Keys, Deputy Secretary for the Department for Children and Families, and you'll be meeting some 6 of my colleagues here in a moment. Before we introduce them and you get to know them a little bit, wanted to get you grounded in the packet of information that you have before you. You have a packet before you. It's almost identical to what you had the first time we met for part 1, have a little bit more data, and I just wanted to spend a couple of minutes to get you grounded so that you kind of remember the path and the scope of work for the regional directors. So in your packet, I'm just going to, as a reminder, start on page 4. As you recall, last time we talked about sort of a central administration as well as regional directors as it relates to child and family well-being services. Today, we're going to give you a few more insights into the far right side of this organizational chart. There's 6 regional offices, 6 regional directors across 36 service centers. Their primary programs as it relates to child and family well-being, they have, just as a reminder, so they're managing and leading and inspiring the protection specialists who respond to child reports. They have the foster care and prevention or family first liaisons, so that body of work and prevention. They have locally in their regions performance improvement, case reviews, quality assurance, so that's under their leadership. And also our regional offices do the post-foster care or foster care alumni. Those adults, after they leave foster care, we have an independent living program that's also within the regional directors. So those are kind of the roles, the 6 colleagues that you'll be listening to. Again, this packet is very similar to last time. Page 11 in your packet does have the reference to the DCF regional map in case you need a reference. And to continue to get you grounded into the regional work of DCF, I'm going to take you to page 21. What you're going to be hearing a lot about for the role of the DCF regional directors is really about how we're becoming a child and family well-being system. So that means collaboration. That means they're in the communities. They're having those community conversations about innovation, prevention, school-based. They are collaborating with courts. So their role as a regional director is a lot of local innovation. We want to make sure that we are alongside families as early as possible, and that takes a lot of partners and a lot of collaboration. We want to prevent unnecessary reports to DCF, and we are really seeking to understand the distinction between adversity a family may be facing or economic insecurities, the distinction between that and neglect. That's some of the community work that the regional directors and their teams are working on. To get your bearings on some of the day-to-day work on page 22 for you, to give you a scale, the regional directors are managing our frontline staff. So that's when we receive a report and we go out alongside to meet a family. Just wanted to give you a sense that about 70% of those reports are related to allegations of abuse, neglect. But there's another 30% that are regarding a family in need of assessment or services. And just to give you an idea, you've got some information on the right there on page 22. The top 3 reasons for why we might experience or come to know a family around an allegation of abuse or neglect is physical abuse, emotional abuse, and lack of supervision. That just sort of gives you a sense. Those definitions are all within the Child Needed Care Code, so they're in current statute. That's where their origin is. For those reports that involve a family who might be in need of assessment or services, our staff are responding to families. About a third of those might involve a family or a caregiver who's overwhelmed, unable to really cope with whatever presenting situation is happening with their family. Also, another third may have a child or a family member in their family that is experiencing some emotional challenges or behavior problems. So that gives you a sense in terms of the workforce that the regional directors are leading. Those are the presenting situations that are happening in their communities. Slide 23, you just kind of have a sense of the distribution of reports. Wichita region, of which you can kind of look at on the map, but the region receives the greatest percentage of reports, followed by Kansas City. Finally, just to get you grounded in some of the governance for the regional directors, like all other industries or bodies of work, we do operate under federal guidance, we have state laws, and then we have best practice. The regional directors are integrating all of that information so that when we receive a report alleging that there's a family in need, they then are working with partners that I mentioned, court, families, law enforcement, schools, community mental health centers, around making sure that we can meet the family's needs as early as possible. You've got some additional data there and some goals and success factors on what they work on. And the last piece we just wanted to show you is on the last page of your packet. Is just a sort of we hope a visual for you so you can understand the path to a regional director. So a call comes into our Kansas Protection Report Center. That's a centralized function we have to receive those reports. When a family circumstances meet such that we need someone to respond to that family, it's the regional offices that are having those DCF employees go out and be alongside the family. Based on that assessment and the body of work that they're doing, then they help make decisions about appropriate service tracks. And the regional directors are key in their communities to make sure that we have an array of services available, that we're managing resources, and that their frontline staff have the resources they need to respond to families in need, to make sure that we are complying with our policies and procedures for families who are in needs, etc. So that's the context of who you're going to be meeting today. 6 of my colleagues just kind of wanted to get you grounded. And I will let them introduce themselves, and Chair, I'll give it back to you.
All right, thank you very much, Tanya. I appreciate it. Before you go, are there any questions for Tanya? Representative Lynn and then Representative Barker.
Thank you, Madam Chair. I'm looking at page 22, and you have the different percentages for the assigned for the alleged abuse, neglect, and also the assessment circumstances. Those percentages almost add up to 100. I wouldn't expect it to be 100, but I would expect there to be overlap. So is it that you're only assessing for one type of abuse or one type of assessment circumstance?
Sure. When we receive a report, it may be assigned for more than one reason, and one report may involve more than one child. So even within a family, there might be different circumstances for different children. What you have displayed in front of you, just for brevity, I put the top 5 most frequent, but yes. So for example, in abuse, neglect, what's not discreetly listed might be the percentage for medical neglect, and sexual abuse is there. I think I'm missing 2, but I just gave the top 5, so I apologize if that's confusing.
But you would see an overlap with, I would imagine, with several.
You could. We do have reports that report like the primary reason, but then we also have reports that include a percentage that might touch any, I'll use the term maltreatment type.
Thank you, Madam Chair.
Representative Barker.
Thank you, Madam Chair. Very good presentation, but on page 22 also, you have 31% physical abuse, emotional abuse, lack of supervision. These are reported. Do you have the percentage of those cases after assessment that were founded to be what we would call founded cases that there's something in there that we need to take action, what would be those percentages? 31% are alleged physical abuse. What percentage would actually be physical abuse?
Sure. So statewide, on average, there are about 4% of all reports. So I'm speaking for all types, not specific to one type. 4% are substantiated. We also have an additional 2 to 3% that we use the term affirmed, that perhaps an incident occurred. We're not able to attribute all circumstances, but we use the terms substantiated and affirmed.
Okay. And do you have those percentages?
Yes,
down for each of these that you have listed for physical abuse, emotional abuse? And do you also have a protocol? Because some of this may be subjective on the worker's part or doing the assessment. And what would constitute, for example, lack of supervision? What is the criteria that you would look at to make that finding?
Sure. So first, 4% of all of our reports. So if we go out on about 200 reports statewide every day. So if you use that, or about 38,000 last year. So 4% of those are substantiated as the child was substantiated as a victim of abuse or neglect. So 4% is the substantiation. That is for all. There may be a difference in between the different types, and I can get that for the committee. So the 4% is for all reports. Within policy, there are attributes and elements that need to be met in order for a report to be substantiated. So there are different facts and circumstances within our policy that we consider. We'd be happy to get that for the committee.
Thank you, Madam Chair. I'd like to have that, if that could supply to your secretary and get it out to us. Thank you.
Representative Blacks.
Thank you, Madam Chair, and thank you for being here. Enjoy your information. And I didn't bring my computer, but did I see the number of statewide children in care? As that went down?
Yes, it's gone down a little bit since about 3 weeks ago when I saw it before. It is now under 6,500. So it was at, I believe, 6,484 this week.
Follow up. Do you have an idea why? I mean, that's a good deal, but I mean, and certainly you want to take credit when things are going good your way, and maybe. I mean, what do you attribute that to?
Well, and certainly my colleagues will be able to chime in, but we know that it's a combination of incredible prevention work going on in communities with DCF resources, for example, family preservation, Family First, but also there are some school-based programs out there in mental health and otherwise that we know are meeting families' needs earlier so that it prevents the need for foster care. We also know that there are increasing number of children who are ending their time in foster care. So anytime you have more children leaving foster care than entering, the overall number goes down. But it's we don't have information that there's any one single factor that's impacting it. We think it's a lot of really good things in communities that are happening.
Okay, thank you for that. Thank you, Madam Chair.
Committee, are there further questions?
Madam Chair.
Yeah.
Just
Representative
add one
Barker.
other. 4%. Do you also have statistics to show how many of those cases are placed, they go to court where custody is placed with the secretary or in a state custody?
We know that last year about 3,000 children entered custody total, and I believe you have a slide on the most frequent reason for entry into care is physical neglect, ages infant of 4 years. We could get data on how many of those children who enter care were a substantiated victim of abuse or neglect. I don't have that off the top of my head.
And could you also give me the duration, the amount of time they're in the state's custody before you can reintegrate either with a family member or back with their parents? Or
Yes, I do have that information if you wish.
okay, thank you, Madam Chair.
Yeah, so the average length of stay for all children in care is 22 months. The average number of months toward reunification specifically is 12 months statewide.
Representative Lynn.
Thank you, Madam Chair. Given that 96% are unsubstantiated, are you looking at the protocols for how these claims are being made, or maybe education for maybe to reduce some of these unsubstantiated claims so that we're not wasting resources on maybe a false alarm?
We are engaged in a Thriving Families, Safer Children initiative that is part of a national conversation, and the Children's Cabinet is with us, as well as Department of Education. There's kind of a sense of, to the extent that 30% of our reports come from mandated reporters who are also educators, we really want to make sure that we're helping communities understand how to get families services without an unnecessary report to DCF. We have a couple of neat programs that my colleagues might speak to in terms of some school-based, but we're trying to do some really targeted work with schools to help shift mandated reporters to also be mandated supporters. So yes, we're actively working on that, and there's a national movement for that.
Thank you, Madam Chair.
Tanya, trying to go back to I'm still on page 22 there. When you talk about the 4%, that is 4% of what? What is that 4%? I didn't quite follow that.
That would be 4% of all. I'm going to consult. I don't know if it's all reports or all victims. Hold just a moment.
That's okay. That's fine.
It is 4% of all children who are alleged to be victims. So if we assign 38,000 reports in a year, one report may have 2 children. So the substantiated rate is a rate of the total number of victims in those, alleged victims, in the report.
Okay. And then you talked about substantiated and affirmed, but I thought we also had, so is affirmed then a new replacement for unsubstantiated?
No,
Or is it in
affirmed began a few years ago, and it is that there's enough information to believe that abuse or neglect occurred. However, for whatever reason, the alleged perpetrator might be unknown, or perhaps the level of acuity of what occurred didn't rise to meet the elements that are required for substantiation.
So then we'd have substantiated, affirmed, and unsubstantiated?
Correct, yes, currently.
So then what happens with the affirmed? Because I'm kind of thinking you're kind of out there in a limbo, which has got to be a very uncomfortable position.
Sure, I understand. Really, the finding with regard to whether or not abuse or neglect occurred helps inform some of our decisions. However, it doesn't preclude any service path or any way to connect a family to services or do immediate safety planning or lasting safety planning. It is really about a decision or a finding on whether or not the incident that was alleged, that could have happened last week or 3 years ago, depending on the nature, did that occur? So the finding with regard to the allegation is just that. Did it occur or not? And was the child a victim of that? We also then integrate other information about safety networks and safety planning, and those plans happen without regard to the finding on the maltreatment.
The one thing that I've always felt like with our foster care systems, we're kind of backwards. In the criminal system, you're innocent till proven guilty. But unfortunately, in the foster care system, the feeling of guilt is there, and then you get proven innocent. And that's kind of a hard path to be on. Okay, you said last year 3,000 kids, and I'm not quite sure I understood the 3,000.
Yeah, maybe we can look at the data trends that you have. I think I have a...
So I think it was in response to Representative Barker's question.
Yes. The number of children who enter care. I'm going to look for that data.
So is that about what we're averaging each year of new kids into the system?
If you look at page 17,
Okay.
it shows you the number of children who enter foster care across years. And in state fiscal year 21, last year, just over 3,000, so 3,081 children had the need to enter foster care.
So these are the kids coming in. Do we also have a chart that shows the kids that are going back home?
Yes, thank you for that. That is on page 19 of your data trends. So in state fiscal year 21, over 3,300 children left care, which is more than those who entered. So that's why overall the need for foster care starts to decrease.
Okay. And then can you also perhaps elaborate a little bit on, is there a difference between sync kids and then kinship care and foster care? What can you highlight that a little bit for
Sure.
us?
So the term a child in need of care overall references the care for code of children, all the statutes. But when a child is adjudicated, a child needed care, and removed into foster care, they would experience a placement type. They're no longer living at home. So they are either alleged or adjudicated to be child in need of care, and they need a place to live. That placement might be with a relative, it might be with kin, it might be with a licensed family foster home. So children who are child in need of care are in a placement with either family foster, a relative, or a kin, or if needed, maybe a more intensive placement. Does that help?
Okay, so they're adjudicated, so now they're sync. Does that place, so is it different then whether it's then foster care versus kinship care? Are they, okay, I'm sorry, let me back up just a minute, because you're the expert on this here, so I'm going to come in from a layman's perspective. So we've decided to remove a child from their home. They've been a sync. Are all kids in kinship care, have they been adjudicated?
All children in Kansas living with kin are not necessarily in foster care. Families can have informal supports, or they can access legal services to pursue their own guardianship. Sometimes it depends on how you're using the term kinship. In the program of foster care, when they're in the custody of the secretary, kin can mean someone that the family or the child has close emotional ties that they want to live with. In Kansas, kinship care for children in foster care, you can be licensed or you might be unlicensed. It just depends. So I think kinship care is one of those terms that has a lot of different meanings for different folks.
And then we also have different rates on foster care versus kinship care, correct?
We have different rates for, yes, licensed family foster homes compared to unlicensed relatives.
Okay. Do you know what that is off the top of your head? And if not,
Yes.
that's fine. Okay.
Yes, I do. The relative rates go between $11 a day, and it's based on the child's needs. So there's 5 levels of care. Again, relatives start at $11, go up to $108 a day. And the family foster home, just to the foster home, there's also an administrative rate. For those that are licensed, it goes to the child placing agency. But that rate paid to the foster parent starts at a basic level of $24 and can go up to $108 a day. And we'd be happy to get you our rate sheet.
I think that would probably be good, because I think some of the concerns we've had over the years, it's great when we can find that kinship care, but that's a big spread between 24 and 11. So
Thank you.
just kind of pointing out. Did I see someone over here with their hand up? Representative Barker.
Sorry, Madam Chair, third time, but.
No, we're here to learn. That's why we're doing these series.
Okay, we've got a percentage of the children that are found to be child in need of care based upon your inquiry, your investigation. If that's the case, then a petition is filed with the district court under Chapter 38, and a temporary order, if placement is not, if you can't do placement home, then you have to file it with the court, and the court issues a temporary order. What I'd like to know, and maybe you have this data, I'd like to see it, a lot of those cases never go to adjudication. They can stay out of the home for 6 months, even though we have guidelines that say they have to be heard within an amount of time. council can come in and ask for a continuance, or I've seen cases where they last a year on temporary orders without a judicial finding of a child needed care, and that's the burden at that time is clear and convincing evidence. So do you have data that says petitions were filed for child needed care and there's been no adjudication in those cases?
We can see if DCF has data on whether or not the adjudication hearing occurred. I don't know if we have that data. We could also ask our partners at Office of Judicial Administration to see if they have it, but we will check. I don't know off the top of my head. Thank you.
Thank you, Madam Chair.
Representative Blacks.
Thank you, Madam Chair, and thank you for really being forthright in your answering. I'm fairly, I guess, ignorant about this situation, but I want to kind of get back to Representative Lynn's question. And we're dealing with 96% that are unsubstantiated, and we're having 4% that are. How long has that trend been that way? And if that's the case, and I think she kind of brought a little bit of that up, does that bother you that somehow our reporting system may be overthinking these issues and jamming up the system? And certainly we don't want any kid to go fall through the cracks. That's not the issue, but it seems like I guess maybe that's a good thing to have only 4% that's actually there. But as legislators, we also get complaints on the other side that, you know, as a parent, we were falsely accused and going through the process. I hear that occasionally. So does it bother you? I mean, has this been a trend that's been for 2 or 3 years in running? And if so, does that bother you that we can, or what do we need to do to change that?
Yeah, thank you for that. We can get data, I believe maybe for the past 5 or 6 years to show it. I don't know the percentages every year, but I think typically, and even nationally, it can be under 10%, although different states have different standards and definition thresholds. In terms of, you know, is that worrisome or bothersome for us? You know, I think we want to make sure, so every state and federally, there are national mandated reporter, and we need to be a resource so that mandated reporters are able to report. I think what we're learning, and we want to learn more with this Thriving Families, Safer Children initiative that we are alongside the Children's Cabinet, is, are there ways through 1-800-CHILDREN or through Warm Line referrals that we can create a way for family members or educators or others who are mandated reporters to help create access to a service or a concrete need that a family has, so they don't feel that an unnecessary report needs to be made to DCF. We do want to increase community knowledge of other resources in neighborhoods for families that they might be able to access. But the system we have is set up so that if there is someone who is worried, there is a number to call. If the threshold meets our statutory definitions that we need to go out and see the family, we want to be as responsive and as kind and helpful as we can to get them connected to those supports, so that the time with us is the minimum time needed to meet their needs at the right time with the right service.
Thank you for that. Thank you. Could I have one more? And obviously, I'm certain that the number of reporting goes up immensely during the school years when the teachers are spending a lot of time with the kids there. Help me, does a report from an individual teacher that she suspects or he or she suspect a problem, will that automatically trigger it, or does the school systems have maybe someone on staff, a teacher that may be a little better trained to work through that issue, or is it just an automatic whatever, I'm a teacher and I see some issue and boom, it's into the system?
I think it could be what you're describing. It's certainly that a teacher as an educator and mandated reporter could make that call. I think what we're learning is that different school districts have levels of support, or they might have staff who are dedicated to also be supporting families so that they can help provide context or a greater understanding of the stressors the family might be under. So I think it's both. There may be districts that have a protocol or a designee that calls, and there may be some that their protocol in their district is for that educator to place that call.
Thank you for that. Thank you, Madam Chair.
Representative Berquist.
Thank you, Madam Chair. I'm going to just ask a question about a very specific situation of a rare brittle bone disease that a young couple that we knew had their firstborn, just a few months after he was born, was broken. And it was assumed that he was broken because he was abused. And so the family started into a 2 or 3 year process of being separated from their child because of brittle bone disease. And so the process of, and doctors would understand this better than most of us lay people, but that when I heard the 4% and the 96%, then I think in terms of the possibility of that broken bone, throwing that into a higher percentage of reported need for care rather than less. And if the parents show, if there's a process to look and see if the parents don't show any other symptoms or likelihood of being abusive, that there's investigation or that case being brought to a medical specialist so that they can see if that's the case. It came back around, but it was a very difficult situation. What do you do when it looks like that it's abuse, but you and all other signs seem to say that it might not be?
Sure. And within our policies and procedures, we do have tools, and in conversations with parents or caregivers, we want to make sure that if there is a question about the injury or we need to understand the mechanisms of the childhood injury, that they see their primary care physician. There are also experts across the state who we can get consultation from. We currently have a pilot going on in Wyandotte and Johnson County that use child abuse pediatricians. So for children who are age 3 and younger, it's mandatory in this pilot, it's a mandatory referral for that young child. So infants and toddlers who may have a voice or aren't able to express themselves to describe that very specific review happen of the circumstances. So our team of protection specialists needs to get additional information from medical professionals with regard to some injuries or a mechanism of child abuse injury that we might not even be able to see or understand, such as fractures or such as internal injuries. So when a family's report includes allegations of possible injuries or injuries that we are not qualified to be able to assess, we ask the family to help by having medical exams, and we do have some additional tools that we can use for that to integrate into our assessment.
Just follow up. Thank you, Madam Chair. So because you may be asking an indigent family to check with medical, is there tools to be able to help them in their defense to get medical help if they're not acquainted with or financially prepared to go and seek analytical doctor's help or something like that?
Sure.
I may be getting too far into the weeds, but I'm thinking in terms of we want to help as many kids as we can, and 4% does seem like a very small percentage of the reported, and maybe they're over-reported.
Yeah.
But
Yeah, so thank you for that question. A couple of things. If health insurance is not available or just otherwise not known, I think we would have mechanisms to help support families be able to meet that need. We also, and you used the word defense, so I might have read into that, but we also do have a pilot for prevention parent representation legal services in a few counties right now, where that every report assigned by DCF for a family in a few pilot counties, we provide them an option to contact and request legal services through Kansas Legal Services at no cost to them. And the family chooses whether or not they wish to pursue that, but they do have an option to pursue parent representation legal services from Kansas Legal Services in a few counties.
thank you. Just to update, the young man is in his 30s and he's a successful chef now, so he came out okay. Thank you. Thank you, ma'am.
All right, Representative Lynn, and then we're going to get on with our regional directors.
Thank you, Madam Chair, and I appreciate the ability to ask all the questions. Given the thousands of claims or the cases that you have to investigate each year, do you have the resources to actually investigate them all thoroughly?
We have caseload ideals that we wish to have, so we know that our staffing levels, when fully staffed, would create a ratio of approximately, ideally, 14 new reports every month for every practitioner on the front line. So we are staffed in terms of the number of FTE, or I'm sorry, full-time equivalent personnel staff that we have, it's adequate. We, like other industries and other public service agencies, we're always needing and wanting more qualified staff. So when we have vacancies, that can be a stressor. But in terms of our ability to budget and project the number of positions needed to respond, we have the number of positions that supports a nationally accredited caseload ratio.
Thank you, Madam Chair.
What is our average caseload now per social worker out there?
I didn't bring that with me.
That's
I
fine.
apologize. I can get that for you.
Because as far as I recall, we've always been short. There's never been enough. Yeah, okay. So would you like to introduce the directors, or how would you like to proceed with this, Tanya?
I will let them introduce themselves, and so Chair,
Okay.
I'll let you take the baton and
All
get to
right.
them. Thank you.
Okay, and if I butcher names, I will apologize in advance. I'm very bad about that. So first I have Pamela Beach, Northwest Regional Director. Welcome.
Good afternoon, Madam Chair. Thank you for this opportunity to address the committee. I'm Pamela Beach, Northwest Regional Director, and I have been with the agency just over 10 years. And I'm so very proud of the work that we are doing alongside individuals and families. I will touch base briefly on this introduction on the collaboration and partnership we have going on. In our rural and frontier counties, there's often a lack, which makes this collaboration and raising up a community that is about child and family well-being, or together having that mandated supporter mindset critical. We hold DCF Connection events, quarterly meetings with over 150 partners, which help us continue to build our capacity in prevention as community. This region has been aggressively working throughout the 2021 and this school year in building collaborative relationships to support those in the schools directly serving children and families. Our regions continue mandated reporter training and facilitated discussions regarding being that mandated supporter and what our local teams can do to support those social workers, counselors, truancy officers, teachers to have the services or resources to pass on to parents and caregivers. Saline County has robust work around truancy and has a parent youth facilitation pilot. Because of the work our practitioners do and the opportunity with the courts, the county has seen a great reduction in child in need of care filings. In Geary County, we are working to improve being a community supporting families, working together to find services and resources in the area to pass to families without our prevention and protection teams being involved. Families are more receptive to accepting the needed supports. Our partnership includes Fort Riley Command and the Fort Riley Family Advocacy Team and others that are serving our military families. We're also working on a SNAP WIC pilot grant through the American Public Human Services Association with DCF and KDHE to design and build a sustainable process to improve cross collaboration for families eligible for both assistance. A family benefit navigator will perform equity-centered outreach and education, in addition to being in multiple agency offices around the community. Additional focus in this area is increasing relative placements and placement stability. These are just a few highlights of the work we are doing as we leverage the power of partnership in our region. Thank you, Madam Chair.
All right, and I think we'll go through all of our regional directors, and then we'll start opening up for questions. Next I have, is it Thomas Buell, Wichita Regional Director? Did I pronounce that correct?
Correct, Madam Chair.
All right, welcome.
Well, Madam Chair and members of the committee, I appreciate the opportunity to appear before you today. By way of introduction, my name is Tom Buell, and I'm the Director for the Wichita region. I've been in my current position for about 5 years and with DCF for 7, but in social services for almost 40 years. So my time is kind of winding down, and we'll hand the baton off to somebody else. I believe you were presented already a statewide map of our regions, but just to reiterate, the Wichita region encompasses 10 counties. Sedgwick County serves as a hub and includes the surrounding 9 counties to the east, west, and south. I believe one of the things that makes our region unique are the community engagement partnerships we've established, and specifically with our law enforcement agencies. Together with them, we've developed cooperative ways to address child safety within the communities. Our law enforcement partnerships include 2 initiatives related to upstream prevention work and 1 partnership on the investigative side. Over a year ago, in an effort to help law enforcement make some decisions as they interact with families in crisis, we established a 24-hour phone number where officers could call and get basic information on the family they've come in contact with. So when they call, we can provide them with a little bit of DCF's history and with the family, and let them know how many children should be in the family as they determine safety while they're in the home. A second, more hands-on project involves DCF funding 2 community support specialist positions within the Wichita Police Department and 1 position with the Sedgwick County Sheriff's Office. These positions follow up with families who've come in contact with law enforcement, and might be some type of family crisis they've responded to and had the children remain in the home. And these support specialists help with referrals to community supports and support of those families. On the investigative side, we are co-located with law enforcement at the Child Advocacy Center here in Wichita as part of the Exploited and Missing Children's Unit. 2 teams of DCF licensed social workers conduct joint investigations with law enforcement related to the most serious physical abuse and sexual abuse cases. With each of these partnerships, the primary goal is to establish the safety of the children and hopefully reduce the number of children entering police protective custody. This is important to the foster care system, as youth who enter police protective custody are more likely to eventually enter the foster care system. Historically, our region has spent the majority of our family service budget on placement of these youth taken into custody. So if we can impact either one of those systems or both, it benefits everyone, families, youth, and the agency. So I'm proud of the relationships we've built and the mutual respect between DCF and law enforcement. And I thank you very much for the opportunity to share our efforts to ensure child safety and support families.
All right, thank you. Next, I have Anita Cooper, Southeast Regional Director. Welcome.
Thank you. Good afternoon, Madam Chair and members of the committee. It's an honor to be here today. My name is Anita Cooper. I'm the Southeast Regional Director. The Southeast region covers 18 counties and we have 8 service centers. We have approximately 260 staff serving individuals and families in the region. I am a licensed social worker and I work for the agency for over 22 years. There are many things I'm proud of in the Southeast region, including the hardworking, dedicated staff that show up every day to serve those in need. The culture of our agency has transformed over the last few years, which has led to positive changes for individuals, families, and our communities. The use of family meetings, team decision-making, family finding, and family first prevention services are some of the most significant changes to our agency over the last 20 years. Working alongside families, which means listening to what they need in order to help their family thrive and keep their children safe, that's what drives our work. Team decision-making was piloted in the Southeast region in November 2019 and now is a standard part of our practice. This means that we have a meeting with the family and their network to discuss safety concerns that has put their child at risk of removal, and we develop safety plans in order to help the child remain safely at home when possible. It is very rare that we have children removed from their homes without having a team decision-making meeting or a family meeting. Family finding is another practice that has been implemented in the Southeast region. We have 2 staff dedicated to searching for family as soon as possible, sometimes before the TDM or family meeting, and most always before a referral is made to TFI, our child welfare partner. Working with TFI, we have been able to place over 50% of the children removed from their homes with family or people they know. Our relationship with our child welfare provider has never been stronger. Family First Services has been critical to our success in reducing the need for out-of-home care in Southeast Kansas. In addition to Family First, the recent award of the 5-year Family Strong Grant, a $3.7 million grant aimed at transforming the traditional child welfare system into a comprehensive child and family well-being system, will bring more resources to families in the region. We are in the planning phase now. The grant will take place in 8 counties. Family Strong will serve all children and families in the target area. Family Strong is a partnership between the University of Kansas School of Social Welfare, the KU Center for Partnerships and Research, the Department for Children and Families, the Family Resource Center of Crawford County, Kansas Legal Services, and Kansas Children's Service League. It's, again, an honor to be here. This is my first time in 20 years doing this. I'm a bit nervous, so thank you to all of you for supporting the work we do in the field. It's an honor to be here. Thank you.
All right, thank you. Next, we have Chanel Dupree, Kansas City Regional Director, and did I pronounce that correct? You're on mute. Cannot hear you.
No?
There we go. Now we can hear you.
Well, you did pronounce my name correctly.
All right.
Thank you, Madam Chair, for the time, the space and time here, and thank you to all the members of the committee and all those watching. I'm Chanel Dupree, and I'm learning to work the mute button, and I'm also the Kansas City Regional Director. And we believe very much in the power of collaboration with our community partners, and through that intentional connection, having those important and tough topical conversations so that we can all meet important outcomes for families that we serve. So a couple of examples of those efforts are seen through the work that our team does through Impact KCK schools at the Avenue of Life in Wyandotte County, Kansas, through the Shawnee Mission Schools program called Project Home, and the Olathe Schools program called Impact Olathe. So all of these programs are targeting families who the school district has identified as homeless. And it provides a collective space for families to get housing, food, clothing, childcare, and their employment needs met. And we're really proud to be a part of these efforts by having staff to attend these events and to help families to receive the services that we have to offer. Another example of collaboration is our intentional effort to connect with our legal system. So I've been with the agency for 3 years, and prior to DCF, I was in the courtroom as an attorney representing children and as a guardian ad litem and representing parents through helping them to navigate through the foster care system. And what I saw really was a disconnect between the agency, the legal system, and the families and the entities involved, which is why we've had multiple continuing legal education sessions whenever a change is occurring, which will impact the legal system. So we're having meetings where we're inviting our legal partners to learn with us and to be involved in how this process works. We're also holding regional meetings to connect directly with our judges and district attorneys so that they can hear about various programs. We can share our data and our federal outcomes, and we can also hear what's working well, what needs to happen. So what are they worried about? And then what needs to happen in the steps that we can take to get there together. And you can imagine folks are always very eager to share what they're worried about, but we are here for it and want to provide that space and that relationship, because that's what it's about. So what I'll say very quickly is that the Kansas City region is no different than the rest of the country. But even in the midst of experiencing staffing issues, our support staff and field workers do an amazing job of using prevention resources that we have to help to keep families safely out of foster care. So we're successfully connecting families with services and preventing the need for foster care at a rate that we haven't seen since 2014, 2013, and we're very proud of that as a region and as a state. So DCF, Care Portal, and the University of Kansas School of Social Welfare. Those agencies, those entities have been leaders in taking the state of Kansas on a shared learning journey to understand the how and the why on why there are a disproportionate number of Black and Brown children represented in the foster care system compared to their population. And this is not just a Kansas problem. This is something that's happening across the nation. So over the past 6 months, we've had 4 online learning lectures, and it will culminate and conclude with a symposium on KU's campus on Friday, April 15th. Finally, I'll say that I just finished doing a series of employee check-ins with about 450 staff across the Kansas City region. And my takeaways are that DCF staff are committed to handling situations that most individuals would run from, that they are compassionate, that we have some of the hardest working individuals here at DCF, and just want to publicly say that I'm very grateful for their service during this time and appreciate the work that you all are doing in your respective capacities as well. Thank you.
Thank you. Next, I have Carolyn Hastings, Northeast Regional Director. Welcome.
Thank you very much. My name is Caroline Hastings, and Madam Chair and Committee, I very much appreciate the invitation to be here. I am serving as the Regional Director in our 9 northern counties. So we've got Shawnee County up to Marshall, Nemaha, Brown, Donovan. And I have been in this role since February of this year. And I wanted to use this time together to highlight some work we've done with substance use disorder and supporting parents who are experiencing substance use disorder as a foster care prevention strategy. So one of the first things we did in April of 2021 was we reached out to the National Opioid Response Network, and they helped us do a series of 4 learning collaboratives. We had 105 unique stakeholders that attended, at least one within our region, so the buy-in was fantastic. But we covered topics such as the treatment strategies and education about amphetamines and methamphetamines, gender differences in stimulant use, the impact of methamphetamine on pregnancy, and then finally we had someone with lived experience talk about the impact of stigma. And Madam Chair, I heard you earlier refer to the feeling of guilt. Like it's hard if you start with guilt and then work to innocence. So when we address stigma, we're trying to help work through the feelings of guilt and blaming and shaming and move them forward to a place where they can get treatment and services. So from our learning collaborative, one of the things that we have chosen to do as a pilot is to specialize one of our child protection workers to really meet those needs and connect with families experiencing substance use disorder. So she has an extraordinary amount of all the resources, and she can also be a mentor to other workers who get cases like that. And then an additional pilot program we're trying through partnership with DECA is peer support. So this would be different from, say, the case management you would get from Family First or Family Preservation. But we have someone with lived experience that can help connect to those parents contemplating or considering treatment or recovery so that they can have those conversations free of blaming and shaming, and so that they also have a positive example of what long-term recovery can look like. So our long-term goal with all of this is to reduce the amount of kids in foster care when we can do it safely, or even by promoting these treatment strategies, if foster care is necessary, decrease that amount of time so it is less than the 12 months to reintegration to really support parents and families in our region. And with that, I would like to thank you for your virtual hospitality and your continued support of prevention efforts as a committee and as a legislature. And I hope you're enjoying our wonderful day.
All right, thank you. And last but not least, we have Stacy Tweeter, Southwest Regional Director. Tweety, not Tweeter. I'm sorry. I knew I pronounced that wrong immediately.
No worries. Good afternoon, Madam Chair and committee members. Thanks for having us today. My name is Stacy Tweedy. I am the Southwest Regional Director. My base office is located in Garden City. I've been with the agency for 24 years. And as you can see by your map, the Southwest region covers 33 counties. We have 8 service centers, and our full-time equivalent staff number is about 286. So I'm really excited to share just a little more about community supporting families. Deputy Keys described it briefly in her summary. We're really excited in the Southwest region to be partnering with Emporia School District, so they're USD 253. And community supporting families. So we're also very excited that we are also beginning to have conversations with our Hutchinson community and partners. And so hoping that we'll get to share community supporting families there as well. The partnership project work was also part of the 2021 National Governors Association Learning Cohort. So Kansas, along with 5 other states, were part of that cohort during 2021, and this particular project was Kansas's project. So our partnership with Emporia School District focuses really on true prevention, coming alongside our education partners. We know that our education partners know kids, like they know when things are changing, they know when there's a difference. And so we are partnering with them by funding a position to assist our educators with early intervention. So this is before they would make a formal report to DCF. And this position is going to help families work to connect with community services. There's also some DCF services available that this position can do direct referrals to, so the family doesn't have to come to the DCF knowledge just for services. We're hoping that by reaching out earlier with families, so before everyone's tummies start hurting, before things are kind of off the track, that our position there, it's really a school district position, but that position will get notified. So I think one of the members asked earlier about the number of reports. And so this is, we think, one of those ways to help. But this position will be reaching out to families and trying to hook them up with existing resources in their community. So these are families and children where abuse and neglect is not the primary concern. So those situations might look like food insecurity or housing issues, might be truancy. So again, not families where abuse and neglect is the worry. We're very appreciative with our partnership with USD 253. We really look forward to seeing the fruits of our labor in that community and the school partnership that's come right alongside us. Really hoping families build their own capacity in their communities, learning their community resources, how to access them on their own, how to stay connected. And then also we have worked with the community of Emporia, with those providers who provide services, so nonprofits or others, and really visiting about those warm handoffs and the 1-800-CHILDREN helpline, and really just trying to bring everyone together so the focus is the same. So thank you so much for the opportunity to share with you all today. Look forward to any questions you might have. Thank you, Madam Chair.
All right, thank you. Thank you very much. I appreciate all of you being with us here today. It's the first time I've had an opportunity to meet all of our regional directors, and I've done this quite a few years. And what I wanted to do in this series that we started here 2 or 3 weeks ago, we started with the secretary, was to educate more legislators to kind of understand how this foster care system works as you know, as legislators, we get a lot of phone calls and there's, problems with the child. Well, this kid should not have been removed, et cetera. And I think I'd like to start building a relationship more with our regional directors so that the secretary doesn't have to take my calls even on the weekend, which unfortunately she does. So what would, if you want to just raise your hand physically, it'd be easier for me to see than for you to find your raise hand key. I struggle with that there, is to, what would you recommend for your region when we get those kind of calls? Who should we be calling in your offices to help this family navigate through this? Because we know that sometimes kids do get removed that maybe shouldn't have for whatever reason, but most of the time they don't. But people are, they're scared. They've just, their kids have just been removed, especially if it is that they're removed from school with law enforcement. Parents are freaking out. You can imagine, and you deal with this all the time, all those emotions that they're going through, and they have no idea who to talk to, where to turn, where's my child, I don't know what to do. So as legislators, who should we be contacting in your offices? Don't jump all at once. I only bite a little bit, and you're a ways away from me. So I have Pamela.
I am certainly happy to start us off. I definitely would open up my cell phone or my email to you all. Happy to take those calls. I do work to keep my work phone on me almost at all the time. If not, I can catch calls and call back relatively quickly. We also have customer service, which I am happy to provide that phone number to the committee also. So I'm happy to provide that so it can be provided to you all.
All right, and then I have Stacy.
So thank you, Madam Secretary. That would be the same for me as well. So I'll be glad to give my cell phone, email address. We also have customer service. Pamela and I, the Northwest and the Southwest, actually share a customer service specialist or manager. We'd be glad to give you her information as well. Thank you.
Anyone else? Would that be the same for rest of you? So then I'll have Tom. Okay, so I'm getting nods. So Tom, Caroline, and Anita, that would be the same for you as well, because we're not wanting this to go out on a public level here. So I think that would be great for legislators to start developing that, because as much as we'd like to say that every one of our people out there are great and wonderful and that they're doing 100%, we know that that doesn't happen. And that's in any profession. Mm-hmm. So my next question, I think, would go to, if you could, maybe you're all kind of the same, so if one of you can kind of do it, is you've got the regional director. Now, who is below you, and then how does that get down to the social worker that then is in regular contact with the foster care contractor?
So this is Chanel Dupree.
All right, Chanel?
Yeah, so it would be the Assistant Regional Director for Programs, and then the Assistant Regional Director for Programs is has a connection to the program administrators for CPS. And so then the program administrators are in direct contact with the supervisors, who are then supervising the workers who are out in the field.
So how do you know if you're, how do the supervisors know? So we're starting with you at the top, because I always tell the secretary, everything stops with her. And she accepts that responsibility, actually. So in your office, the buck stops with you. How do you know that all of your social workers are doing what they need to do to actually get these kids returned home? What kind of systems do you all have in place for that?
Well, so of course we're privatized, which means that our foster care liaisons are in, direct contact, of course, with our contractors, right, with our grantees, and are involved in those cases. And there's just constant contact and staffing and communication when there is an issue that comes up. But just generally speaking, how do we know? Sometimes, unfortunately, you don't know that there's a problem until you find out that there's a problem. And then when you find out that there's a problem, then we have systems and mechanisms in place to begin addressing those issues.
Okay, and I know I'm going to throw a lot out at you. This is not going to be the last time we visit with all of you. But I think there's, it's also would be a case of, if I understand correctly, perhaps our social workers, whether it's the DCF or the contractor, are not all, that are working directly with the families, are not always able to get the information input so that we actually have live data. Would that be correct? On a child's file. No one wants to answer that one?
This is Anita.
Okay.
I would like to talk about this just a little bit. Normally, the concerns from the legislators come through Mike Dinas, and he sends to me as the regional director, and then it goes right out to the assistant regional director, who gets all the details of the case, the history, everything that we can provide to you. We do that. So I'm wondering if that's working okay. Do we want to change it?
Well, and just to kind of piggyback off of that, right? So our system is basically, when we get an email from Mike, when we get an email from anyone in administration saying that there's been a request from a legislature, it's like the wheels start churning, right? And then we have a ticket system within our region regarding customer concerns or customer affairs. And so it gets forwarded to who it needs to go to, because again, there's many layers, and you have to figure out, who's on the case and the information that's needed. So I do agree with Anita, like, has there been a concern with how the process has been working and how the information is being presented? Because quite frankly, when you call, we jump and say, Secretary, how high? And then we jump that high and we get you the information that you need.
Well, and I think, I'm talking about, more because, we know that we're going to have anecdotal cases that come to us because of a misunderstanding, perhaps it's terminology, et cetera, is the cases where we've been able to identify that perhaps a social worker, and again, because I look at it this way, this is my perspective, is that DCF is ultimately responsible irregardless of the contractors that are out there.
Right.
So if they fail, you have failed. And so how do we deal with the social worker or the worker that either is DCF or with one of our contractors to make sure that they are doing everything, that they are doing things timely, that we don't have delays because appointments are being missed or not happening, or follow-up calls? There just seems to be a breakdown in, I think, some of the communication, and I'm not quite sure how we get to that. So, and I know that each one of your offices are different.
Quite frankly, I think that as long as, and I know it's true for each of our offices, as long as when we become aware of an issue, that we have a system in place to address the issue in a timely way, that would be like our best hope. Because we know with any system, with any process, there's always kinks, there's always going to be concerns. The issue is that now we're dealing with kids, and so they're precious, and we need to make sure that we're doing our very best. But again, mistakes happen and things are missed, but what we want to do is always just have an opportunity to course correct and make sure that we're circling back and following up and just doing a better job with providing the services that we need to for families.
All right, Representative Blex, I believe you have a question.
Thank you. And I'm not sure who to address that. I retired from a state agency and as a mid-level supervisor, and whenever we were instructed by agency policy that whenever a contact come in from a legislator that we were to actually forward that on up the chain of command. Does your organization have this kind of a policy, and you kind of went into it a little bit, but how do you handle that situation? Is this something the secretary mandates, or maybe Tanya here could fill us in on?
So I've only, of course, been here 3 years, and typically requests don't come in directly to our staff. Usually, again, we're getting the request from administration, so from Deputy Secretary Keys or from Mike Dinas, or from Secretary Howard, and then our wheels begin to work. So that's typically how it's worked for the Kansas City region.
So the agency doesn't really have a policy that says, hey, when you get a call from a legislature, I as secretary want to know about it. Just where do we stand on that?
I don't know if it's necessarily a policy. I think it's just very much understood that we need to make sure that we're looping our leadership in, and we're not going rogue and doing things that will embarrass our secretary and our leadership. So no. So again, I'm not certain if it's an actual written policy. It's just very much understood that, again, we need to make sure that our leadership is aware of what's happening if there's a request from a legislature.
Okay, and I believe, Representative, that Tanya probably has a comment here for you.
Okay, thank you.
Tanya?
Thank you. Yes, Tanya Keys. I did want to say there's certainly no wrong door to receive a concern or a call. So we want to make sure all of our team members know if you hear a concern, listen to the concern. But yes, we do, although I don't think it's written, we do have a courtesy amongst ourselves that we make sure that our legislative team knows so they can be responsive ultimately to a legislator's request, and also to understand themes and trends. We do like things reported centrally just so we can track them to understand if it's emerging or a known issue. But yes, our communications director, Mike Dinas, and Secretary Howard are informed.
Thank you. Thank you, Madam Chair.
Committee, are there further questions for our regional directors? This is not something we get to do very often. And I want you guys to feel like that we're not all up here to, beat you up, because I know that you catch a lot of flack sometimes, but we want you to be able to reach out to us as well, because when we change policy up here, it's primarily done because those that are out there in the workforce are actually giving us the recommendations and the suggestions on how to change things. Because I'm not a social worker, I don't work in your area, but I've been able to help with a lot of legislation over the years in this area because, again, the people that are out there working in this area. So any other questions, committee, or Representative Lynn?
Thank you, Madam Chair. I'm just hung up on this 4% thing. I'm curious to know if other states have a similar percentage as far as substantiated claims, because I feel like we're either over-reporting too many, or we are those kids they're slipping through the cracks, and that's my concern. Maybe the 4% is standard, but that just seems really off to me.
Well, and I think that's something that, Tanya, we could maybe dive into a little bit deeper and analyze that, because you like to go into those numbers, Representative, and I think that would be a good one. And I think that, if you wanted to perhaps visit with Tanya, and then whatever you guys kind of come back with, present it back to the committee, would that be good? All right, thank you. What's her name? Heather Meyer. Representative Meyer.
Thank you, Madam Chair. I just wanted to let you all know that it is Social Work Month, so I wanted to wish everyone a happy Social Work Month, from one social worker, probably another, to all of you, and thank you so much for being here to get this presentation today.
Committee, are there further questions? Representative Ellis.
Thank you, Madam Chairman. Last summer, I had 2 grandparents call me and wanted to find out where their grandchildren were. And so I called Susan Concannon. She gave me one of your numbers. And within 2 days, they located them because their children had gotten in jail and they were worried about their grandchildren. So that was done very well. Thank you.
All right. Further questions or comments for any of our folks? I guess I would, like, again, I would, reiterate that, for you guys to feel free to reach out to us. I would encourage legislators to reach out and visit with you and talk to you. I know that in a lot of our areas is our sync courts will allow legislators to participate, or not participate, but to observe what goes on. And if you've never done that, it can be an eye-opening experience and gives you another level of what actually happens in the courtroom. So thank you very much for being here and taking time out of your busy days, and we'll look forward to visiting with you in the future. Thank you. Bye-bye.
Thanks so much.
Tanya, I want to thank you for bringing this together, and we're going to continue this discussion till the session's over, and then maybe next year we'll, start things up, because the idea is for folks to understand how complicated this system is, and that we want to learn and we want to make it better, because I know where the heart is of most people, but I think sometimes with the load and everything that we deal with, and we've always had a shortage of having too many caseloads on one individual. So committee, we are adjourned. Are we on tomorrow, Dave? All right, we'll see you at 1:30 tomorrow.